All right, well, if it's okay with you, Megan and Robin, we will go ahead and get started. So thanks everybody for joining us. This is the part of the MSKC Research Chat series. So Megan Burke is an associate professor of special education. She is a current grant recipient of the MSKC grant program and here to share her work on exploring the needs of military families of children with disabilities. She has partnered with the Military Families Learning Network, which is a great organization I'm sure we will learn more about today, and we've heard about in some of our previous presentations as well. So happy you're here, Megan. Feel free to ask questions, everybody, throughout, so you can submit questions in the chat box. And then Megan, whatever you're comfortable with, if you want to come take questions throughout or wait till the end, whatever works for you. And we'll go ahead and let you take it away.
Sounds good. Thank you. Yeah, we're happy to take questions throughout. Robin and I are both here, and we're going to kind of share the presentation. So I'll kick us off. Just for some background, our project really looked at military and newly civilian families of children with disabilities, and there's not much literature about military families of children with disabilities. From the research that there is, we know that military families of kids with disabilities use about 6 disability services a week. So they're quite busy in trying to access services for their children with disabilities. We also know that these services really matter. So when children receive appropriate services, there are long-term benefits, both to the child as well as to the family. Unfortunately, we know that military families and even newly civilian families face a lot of barriers in accessing services. So it can be hard to access timely services. It's hard to maybe identify what the service is that the child needs, to determine who the right provider is, to prove eligibility, and then to finally get the service. That timeline can take quite a bit of effort and quite a bit of time. It can be hard to find the appropriate professionals. A lot of these services come with our own bureaucracy, so that can be difficult to figure out what the rules and regulations and eligibility schemes are for those bureaucracies, and can be hard for families to navigate. And then finally, for families who are moving, usually there are different systems in place depending on the area that you move into. So the transition process of moving into a new school or community and then having to kind of restart this process all over again can be difficult. So for the goals for this project, we had 3 goals for the grant that we received. The first one was to kind of address some of the gaps that I just mentioned by developing a program called SPANS, which stands for Supporting Parents to Access and Navigate Services, to develop what we were calling military mentors. So this means that we are training people who have been in the military or are currently in the military and have children with disabilities themselves to learn how to support other families of children with disabilities who are in the military in accessing services. So first step was developing the program with input from military families. The second step was actually conducting the program to see if it increased the knowledge, skills, and capacity of the M&Ms to support families. And then the third step was to look at how M&Ms then go on to support other families. I'll turn it over to Robin to kind of talk about our collaboration and specifically talk about MFLN.
Sure, thanks, Megan. So I'm Robin DiPietro-Wells, and I am the program coordinator for the Military Families Learning Network early intervention kind of concentration area. The MFLN is a large network of varying focuses, or is it foci? I can never remember. And one of those areas being family development and early intervention, which is early childhood, early interventions, birth to 3 with special education needs or with disabilities, and then early childhood being up to about age 8 with early childhood special education. So we support those professionals through online PD. And Megan asked me to be a part of this project because of the military angle and my understanding both professionally and personally of military programs for families with children with disabilities. The MFLN as a network, though, provides web-based PD for a variety of areas. Early intervention is just one of those. We also do finance, nutrition and wellness, things like that, but I handle the early intervention and early childhood special ed piece.
So we were lucky enough to get to partner with Robin and the MFLN. We also partnered with an agency called PETSI, which stands for Parent Educational Advocacy Training Center. And this is a parent training and information center in Virginia. There's at least parent training information centers, or PTIs, are federally funded, and they are primarily staffed by parents of children with disabilities. And they are designed to educate parents about their special education rights so they can navigate and access services for their children. PTSI is a little unique compared to other PTIs in that they primarily serve a lot of military families, and the staff there are actually primarily military or newly civilian parents of children with disabilities. So it was a nice kind of natural partnership between us, the MFLN, and PTSI to really make sure that we were getting that perspective throughout every aspect of the project. So for each of the goals that I just mentioned, we have different methods kind of associated with it. The one that we were going to focus in on today was the interviews that we conducted with military and newly civilian families of children with disabilities to really inform the content of the SPANS program, but we also conducted pre and post surveys. Oh, and I have like underlining there. Okay. So in terms of our participants, we had a little over 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 participants in our interviews. They were all military parents of children with disabilities or newly civilian parents of children with disabilities. They came from all over the country, and the idea is that we conducted interviews with them that were roughly an hour long to really understand what are the strengths of military families of children with disabilities when it comes to accessing services. By identifying those strengths, we could capitalize on them in the program. And then also identifying what are the support needs that are very specific to military families that really need to be addressed in the curriculum. So if you look at this, I think I have more animation. Those are kind of the pseudonyms on the left column. You can see the states that are represented. So we have Tennessee, North Carolina, South Carolina, Virginia, and Illinois. So a handful of states were represented in the data collection, and many of these families had lived in multiple states and were kind of reflecting on their own experiences in different locales. And then we also have diverse disabilities represented. So this was really to make sure that we have a pretty heterogeneous group of people in the study to make sure that we were understanding common themes across different types of disabilities of the children. So for the interviews themselves, we kind of went in with 3 questions that the protocol revolved around. The first being kind of what are the unique circumstances of being a military family of a child with a disability, and then also what are the barriers and what are the strengths. We conducted these 1-hour-long interviews with each participant, which resulted in almost 200 single-spaced pages of transcription. So our parents had a lot to say about their experiences and what they wanted in an advocacy program. We then kind of summarized each of the interviews and went back with the summary to each of the participants and said, does this accurately reflect what you said? Do you have anything to add, anything to change? Just to make sure that we were capturing all of the right information from the families. So I think, Robin, if you want to go over this, these are some of our findings.
Sure. So as you can see on the slide, family members discuss the Exceptional Family Member Program. And for those who may not be familiar, the EFMP, as it's more often called and referred, is a program for military families who have a family member of any age from birth to, I usually say cradle to grave, who has a disability and isn't the active service member. So it can be a child, it could be a spouse. There have been times where this also could extend to, say, a sibling who is an adult but is under the guardianship of the active duty member because of their disability necessitates they have a guardian, those kinds of things. But this is a program that is a required program for families with a member with disabilities to enroll in, but that is not necessarily monitored or enforced, I guess is probably the word I want to use. So even though it's a required enrollment, mandated, it doesn't always happen that they do, that the family member or that the family enrolls. But our families were pretty familiar with it in terms of knowing about it. And you can see that there were positive and negative experiences that they relayed, being that it was, one family said it was fairly easy to understand what they could do, but that, it hasn't been able to give a lot of recommendations, but getting into it, getting enrolled in it, all of the paperwork piece was pretty easy, is what Bree told us. Casey, though, said that she, that it got lost in a shuffle, right? And that they weren't going to be able to provide much that she wasn't already doing. EFMP is a DoD crafted policy. It's well crafted, and it's, but like others, it's a good policy, but can be, struggles to be implemented on the ground, if you will, with fidelity. And there are some variations in experiences because of the wide swath that this large program covers, and the way that isn't always implemented the same. But that was kind of what our individuals had to say and noted as well.
Yeah, and I think right around the time when we were collecting the data, this testimony came out that's on the right-hand side that really reinforced kind of what our findings were, and what Robin's spoken about is just kind of is a great idea, but there are some issues in terms of implementation that we were seeing. Other unique military experiences related to TRICARE, which, Robin, is that okay if you go over?
Yeah, that's fine. That's fine. So again, TRICARE, in case you're not familiar, is the Medicare. No, it's not. It's the medical health care program similar to health insurance, and provides. It functions very much like an HMO for many families. They have a variety, like your own insurance. They have a variety of plans and things that you can enroll in, and you have some options there, but it basically is the medical healthcare coverage. One of our, I think there were several of our participants who said, that had positive experiences in what it covered, and the way it would cover services, right? But then, of course, there were also parents who characterized it as being a beast, and lots of experiences of having to jump through hoops, and to get that phenomenal care, to get that good coverage. And I sometimes wonder if that's unique to TRICARE, or if that's also just part of a process with health insurance in general. But these were what our individuals had to share with us about their experiences specifically related to TRICARE. Megan, did you want me to talk about deployment, or did you want to take that?
You can go ahead and take it.
Okay. So with regards to deployment or relocation, when we were doing these, it can be kind of hard to know when we think about relocation, whether that means like moving, or whether that meant they relocated because of a deployment. So sometimes these can get a little confusing, but a deployment's when just the service member goes to another location as a part of their job. Sometimes there are some slight nuances between deployment and TDY in terms of temporary duty, but either of those, in general, almost always mean the active duty member leaves and goes somewhere where the family is not, in order to complete the mission as a part of their job with the military. Relocation would be when a family is relocated and then has to transition from one location to another, and that's when the entire family goes. Sometimes that happens along with deployment, because a family might opt to go back closer to where they have supports if their duty station is not where there are supports. So the spouse and children may also relocate at the same time. Leah noted that it's hard because you have to deal and cope with not only your child's needs, your child with disabilities needs, but then the fact that your spouse is deployed, and oftentimes a deployment involves being in a dangerous location or engaging in a dangerous mission. And so there's worry and anxiety that also then adds to what is on the at-home caregiver. And by at home, I simply mean the one that's not deployed. And then with regards to relocation, this piece about finding new providers and new therapists and waiting lists and going through all of it again and again and again. And relocation for military families, the last information I really looked at said it happens still about every 2 to 3 years. It varies, of course. It doesn't mean everybody's moving every 2 to 3 years, but on average, I think that's the most recent stat that I recall seeing. There may be an updated one now. And I think, of course, COVID, of course, probably changed that significantly. But, if you can imagine this parent's experience having to every 3 years or so find new people, new providers, and go through the same kinds of evaluation in this process and connection and trying to find who to talk to and all of that, that can be very exhausting and challenging. And that was also found amongst the participants.
So in terms of, barriers within that context, families talked a lot about limited school resources and that they would often move to places that really didn't have much to offer for their child with a disability. So Casey kind of specifically talks about at one point being stationed at a certain fort and that it was really hard to find inclusive programs for her child. And so that was a huge barrier for them. We had another family that also talked about just kind of their own limited capacity to be able to advocate and specifically feeling kind of overwhelmed and stressed. So Bree talks about it's stressful and exhausting, having to manage a 9-year-old with a disability who has some behavior problems and will blow up and have a meltdown. And then you add in the fact that she also has 3 other children in addition to that child, and that, when her husband was deployed, she'd be doing it all on her own. And so it's exhausting. So to add advocacy and seeking out services on top of that can feel really overwhelming. And then another barrier was limited services in general. And so kind of speaking to Robin's point that she mentioned about deployment and relocation specifically, is that different states often have different guidelines about qualifying for services. And that's not just school services, but other services as well. So when you live in one state, you may qualify for certain services and then you move and your child doesn't qualify. And so that can be really frustrating for families. And was definitely kind of a common theme that we saw coming up again and again. But we also found that there were a lot of strengths of military families, and this was really helpful in thinking through what the training would look like and what can we really capitalize on. So when we asked about strengths, a really clear theme was about perseverance and resiliency. Families responded like they were able to get through hard things. A lot of families came up with certain mantras that they would say over and over again, like, we do hard things because we're a military family, or just keep swimming, or we get through it. And so it really kind of shown how they're able to navigate some really hard circumstances. Amber talks about, being a spouse, that you have to be strong, you have to be independent, you have to be resourceful. And when it comes to disability, that those characteristics really help in supporting your children. Another thing that was really clear is that there was a strong military community. So when they got stuck or when they didn't know who to turn to, they often talked about having some peer support who was able to kind of come in and help support them access services. And then kind of one of the more interesting findings is military presence in school meetings. So for students with disabilities, they often have what we call IEP meetings, which stands for Individualized Education Program. And that's a document between the family and the school outlining the services the school is going to provide for the child. And you have to meet at least once a year to go over that document. Those meetings can be really stressful for a lot of families, and it can be hard for parents to advocate in that context for services. And that was definitely true for military families, but a lot of them talked about bringing the military member in the family to the meeting and actually saying, in our case, we had a lot, almost all of our participants were women, and all with the exception of one were spouses of military members. So all of them brought their husband to the meeting and said, you're going to go into the meeting, even though you don't know much about special education, you're going to walk in, you're going to wear your military garb, and I'm going to tell you what to say, and then we're going to get what we want during those meetings. And really talked about how their husband as a soldier was treated much better than they had been treated at the school. So this is kind of an interesting finding in kind of understanding why does that happen? What is it? Because it's a man who's coming into the meeting? Is it the military aspect of it? One participant, when we probed a little deeper and said, why do you think the school responds so differently when your husband's in a meeting versus when it's just you in a meeting? And she felt like the school perceived it as their patriotic duty to like provide services when they saw their husband dressed in the military garb. And I thought that was kind of interesting and definitely not something you see in the rest of the literature with non-civilian families and thinking about. So definitely some room there to grow and think about what's going on, that these meetings are so different depending on who's in attendance. So in terms of using the data, we then kind of turned to the curriculum and said, okay, how do we use this data to inform what we need to cover in the curriculum? And we did this with Robin, myself, and then Pete, which is, so pretty much everyone on the team with the exception of me is a military parent or newly civilian parent of a child with a disability. And so we found like maybe there's not such a need to focus on teaching advocacy skills because these families are already identifying within themselves that they have the skills of being really resilient and being really resourceful and being persistent in accessing services. So that's already a strength. We don't need to teach that or to emphasize the importance of some of those skills. What was a clear barrier is that it was hard for families to move to different locations and to understand what are the new regulations, what are the new policies and the new systems they need to learn to access services. So we thought it would be really important to emphasize, here's what the federal laws say about what you're entitled to across states, but here's what your state special education law says. And so that way when they move to a different state, they can know like, I was entitled to this in Indiana, but now that I've moved to Illinois, I'm no longer entitled to it. Those kind of things were really important. And then they really wanted more information about objective information about accessing services and not focusing on kind of the more affective component of advocacy. So a lot of families said things like it's overwhelming, it can be stressful to access services, it's emotionally kind of laden. But when we asked, do you want the training to focus on stress and coping mechanisms and things about well-being, they were like, no, I don't want any of that. I just want the information. I just want it straightforward and I want to know how to get my kids services. So that was kind of interesting in terms of crafting the curriculum and making sure what we were focusing on was something that they needed in the right kind of modality. So I think that was all I was going to cover since we only had 45 minutes, but we went through it quickly. So I'm happy, or Robin and I are both happy to answer questions about any aspect of the project. Again, that was just one of our goals, but.
Thank you, Megan and Robin. Super interesting. There's a lot of things that I was kind of surprised about and not surprised, I think, given the military community. I guess I just had kind of a comment or question around the last one, or one of the last points you made around not wanting an effective or affective component to the advocacy and kind of the just really want the like clear direct information. I'm just wondering how much that has to do with like military culture in general. I think just kind of the sort of conditioning around stoicism and clear direct communication, kind of straight to the point. So that's just what I thought of when you brought that point up. I think that might be reflective, of course, of sort of the larger culture in which those families are situated. Super interesting.
Yeah, I think we had some participants who said things like that. Like if we advertise the training as something that would help alleviate stress or like include coping mechanisms, they were like, I wouldn't go to a training like that. They were like, and other military families wouldn't go to that. I don't know, Robin, if you have anything to add.
Yeah, I mean, it's so, I think obviously I was a military spouse for 12 plus years. And then I have I have children with disabilities. I mean, I do have parents, don't be mistaken, but, so for me, in my experience, I was thinking the exact same thing. Like, yeah, I wouldn't do that. And the reason for me is because, and my experience, many of us military wives, we're just very problems and solutions oriented. Just solve the problem. How do we solve the problem? Because, and for me, it's always about, because there's another one right behind it. that I'm going to have to solve. You know, and whether you want to call it a problem or an objective or whatever, you know, depends probably on your whether you're an optimist or a pessimist. So clearly, you know, now that I am the pessimist of the group. But you know, and I find that that's true of other military spouses with whom I'm friends. Right? We just want to, you know, check, meet the objective, solve the problem. Okay, next. And there really isn't a moment where, I mean, I think there are moments in between where we get together in our very close communities and say, you know, here's how I feel about it. But I've often said myself, and I've heard other military wives simply say, if I stop to talk or think about how I feel, then I cannot do. And so therefore I need to do. So that might be part of it. Coming from that culture as a military wife, I would say that those were my experiences as a part of the culture. And it's just an undercurrent, whether it's taught in any way or conditioned in any way. It's hard for me to extrapolate myself to be able to tell you that. But it's definitely a part of it.
Yeah, that makes sense. I think when you're talking about, you know, kind of a doing mode, it made me think of sort of the mentality of like always accomplish the mission and sort of, you know, getting things done and being in that sort of doing mode, which is very much part of the culture, which is, I think, reflective of the desire to really want to know policy. Because one of the questions I was thinking of whenever you were talking about you know, qualifying for services and how it varies among states, I was thinking, well, you know, isn't there a federal sort of, you know, policy that would, you know, be applicable? So it makes sense that they would want to know, sort of being in that state of mind of, you know, what's the information I need to be able to have the services I need for my children, that it would sort of mirror that, you know, wanting the information, what's the policy, you know, what's the action, and sort of accomplishing the mission, right, of providing the services that my children need. So super interesting.
You know, the other thing to that is that there always, for me, seemed to be a timeline. There was always a deadline. It was always a short turnaround. Like, we need to do this now because this is coming around the corner. I need to get this accomplished because, you know, TikTok, he's probably going to leave again, or need to get this accomplished because TikTok, we're going to be moving soon. You know, I mean, it's just, there always seemed to be a time pressure that now in a civilian life, I don't feel as much, or it's different, but, you know, it's not that there's this, something's going to come out of the blue and upend our lives because we are serving the military, right? And so some of that too is, I don't have time to deal with the stress. I need to know the policy. I need to solve it, right? But yeah, that's definitely something there too.
Yeah, absolutely.
Well, I think the point about the learning the policies, I mean, that came through like really clearly. But I think what's kind of interesting is there is not quite a parent training center, but there is a parent center that focuses on military families. And because they realize that military families often move, they focus on the federal policy, right? And so all of their training is, as I understand it, their trainings, their materials focus on the federal policy. But then when we worked with Pizzi, that's in Virginia, they were like, that's actually not enough to help these families to focus on the federal policy, because some states have really sweeping differences in terms of how they implement those policies. Like Virginia, like they have lots of different rules because you have to do at least what the feds say, but you can go above and beyond. And so they were like, you actually do need to learn a lot of kind of the state differences in order to be able to access services in Virginia, whereas in Illinois, we don't go above and beyond. So things are actually pretty similar. But it's just kind of interesting in thinking about how can we walk that line of making sure that information is relevant to them, but also making sure they know where they're living, what the differences might be, right?
Yeah, and I'm just wondering too about as this clarity is sort of coming through in the data around this is really a big issue for them. What potential policy recommendation implications, you know, could be there as a result of sort of learning this about, you know, of this being such a sort of great need in the military family space and community.
Yeah, I feel like we have so many. I mean, it's only a few participants, right? So we didn't want to like go huge with policy and practice implications, but we just submitted the manuscript a few months ago for publication, and did put some policy implications in there around like EFMP and implementation, and then also around TRICARE, with people saying like they really liked TRICARE, but they struggled to access and navigate it. Which in some ways is kind of a nice policy and practice implication, because you're not really asking for more money to do something or to add something, you're asking for resources and training so that people know how to navigate things, right? Which I think is usually a little bit more of an easier of an ask or more realistic, maybe, hopefully.
Yeah, that makes sense. Other questions? I don't want to capitalize all the question time. So other people have questions or comments on the presentation?
I can just one comment that Megan made me think of here is that, when we're talking about policy, I always tried to look at know the policy, because then I could know it and assume good intent by the military, by the school, by the office, by whomever I was, trying to, that I was advocating with. So I could assume that their intent is good, and that perhaps they just didn't know that this is what the chapter and verse says, right? Or perhaps they weren't sure, or because policy is big. These policies that we're talking about when they surround defense, they're so big, and there's so much in them. And so I always knew what I needed to know, not so that I could use it against them so much as though I could assume this good intent and then put them in a position where they're not feeling defensive, but where it gives them room to be like, oh, okay, yeah, wow, I didn't, this is a big document, I never saw that, those kinds of things. And so for me, it was a strategic tool to know the policy, because then if it wasn't happening, I could simply say, well, did you see this here? And then we could move forward without needing to become too confrontational or defensive. Yeah,
right.
So that's one of the reasons I think it's important for them to know.
And that could make sense. I'm just thinking about the feedback around sort of affect. That could make sense in terms of, right, just if I know the policy, it's going to kind of could prevent or could mitigate my sort of perception or interpretation of what the intentions on the other side might be, right? So it could just be sort of a misalignment or misunderstanding around what the policy actually is, which makes sense that then thinking about the advocacy training, if I know the policy, then there's less of the sort of emotive affective part, in the whole, situation in general.
Right. Because a lot of the times, for me anyways, it was about, I don't care whether you're doing this to be untoward and ugly or whether you're not. I care about the fact that this is what it says my child should have, and this is what my child's going to get. And so it served no purpose to point a finger or have an argument. I needed the policy, so I could simply say, see, right here. And then we could just make it happen, right? So again, it's that piece of like, I don't need to process whether you did right or wrong here. We just need to move forward, accomplish the mission, right?
Right.
So yeah.
Yeah, that makes sense.
I mean, it is kind of interesting, like the processing piece and the affective component is interesting because the broader literature about, civilian parents of children with disabilities, like really emphasizes peer support and high stress and like coping mechanisms and all of this, like all of these things to address. And then in this, when we asked them about it, I mean, there were people who were clearly like, this is hard, it's overwhelming, I don't have anyone to talk to. When my husband's deployed, even when I do talk to him, I don't talk to him about anything related to services or disabilities because I don't want to distract him. So really kind of feeling isolated. But then when we asked, do you want that in the training? They're like, no, I don't want any of that in the training. And that it's really very, very different than kind of the general literature.
And some of that could speak to the fact that there is this real unique culture that exists, like we talked about earlier, but in so much that, those things we process with people very, very close to us. Mm-hmm. And so somebody giving feedback on, well, here's how you deal with stress. It's just that's not helpful, because all things in our lives are uniquely knit together amongst a military community when we're in it. And so it just wouldn't be helpful because we're getting that met somewhere else, because that is a part of the culture to come draw in real close. That could be part of why that is a difference between what the literature finds and what military spouses are saying.
Mm-hmm.
And I wonder too if you might see that different from the sample you worked with. Are these families that were still in the military, or were they separated, newly civilian?
Some of them were still in and some of them are out.
I wonder if with a larger sample, if you would see a difference between people that were still in that response versus people that had been out longer, maybe not like immediately separated, but had time to kind of be more in the civilian space versus in that close-knit military space. If you might see a difference between, I would imagine so, but won't know until you look.
Yeah, no, I think that's a good point. I think what it really reinforced, and which we like knew from the beginning, and which Robin definitely knew from the beginning, is that like we really needed to get those perspectives in there to figure out what that training was going to look like, and we really needed to make sure because a typical advocacy training would look kind of different than what we heard from these parents. And so like the partnership between Robin and I, and then with Pete C, and then with these military families giving input, like that, those partnerships were really critical to the entire process of figuring out what does this look like.
Yeah, I think that's something, we find in the MSKC, sort of the research office at CHES, we find across the board, I think any type of engagement, research engagement with military veteran communities, having people that are in those communities part of the entire process makes such a difference. And even knowing, like what questions we're asking, how we're shaping the questions, how we're thinking about participant unique experiences embedded within the larger culture. That we're doing the research, within that space. So that makes sense. And I think that it's clear the partnership really added a lot to the project. There was one more thing I did want to touch on, just because I was not surprised, but thought it was super interesting, was what you talked about with the spouses in schools, and where it was, somebody coming in uniform to talk to, particularly usually male service members coming in uniform, talking to, school representatives, and having a more reactionary or more sort of positive, receptive response if somebody's in uniform. Just super interesting. I'm not completely surprised by that finding, but nonetheless, it's fascinating.
It's so interesting. I mean, I see it in the broader literature where, it's usually moms who are going in and advocating for their children in those school settings, and the moms will sometimes bring their husbands, fathers, whoever, to the meeting, and they feel like the male kind of changes the dynamic in the meeting. This is the first time that I've heard like the male plus the military aspect really changes the dynamic, even though it's the mom who usually knows everything about services. And it does raise it raises interesting questions. It also raises interesting like research approaches. Like, how would I test that? Would I go in and give one group of moms like a pseudo military husband and send them into the meeting, and another group just a regular, and it's kind of interesting that gender military presence would change the dynamic so much.
It is super interesting, and it would be hard to look at. I agree completely. I think particularly if the schools, are more responsive, are more like provide services, if somebody in uniform sort of comes and does that talking, and if that's tied to some inherent, patriotic sort of sense of doing or sense of duty, super interesting. I think there's a lot that could be explored, in that space. Again, it would be challenging figuring out exactly how to explore it, but I think that there could be something there with that.
Yeah, great.
Interesting. All right. Any other questions or comments for Meghan or Robin? All right. Well, we will go ahead and conclude. So this has been recorded, so it'll be available on our CHES Center website in a day or two after the presentation. Thanks again, Meghan and Robin. This is super interesting. Appreciate this work and excited to kind of see where it goes.
Yeah, thank you.
Thank you.
Thanks, Meghan and Robin.
Yeah, you're welcome. Thank you.
Bye.
Bye-bye.
What you said?